I'm joined by Dr. Sue Cheng. Dr. Cheng's a board-certified radiation oncologist with Morris Hospital and Healthcare Centers. Dr. Cheng practices at the Radiation Therapy Center of Morris Hospital at 1600 Route 6 in Morris. As March is Colorectal Cancer Awareness Month, and we're going to spend a little bit of time talking about colorectal cancer.
I like commenting that February was Cancer Prevention Month, and colon cancer this month is a highly preventable cancer.
Okay. All right. Tell us about some colon cancer statistics, if you would.
Yes, colon cancer is extremely in the top 5 list, probably behind breast, lung, and prostate, but in both men and women, it's unfortunately pretty common. And so based on all the previous years, we are projecting up to 151,000 Americans to get colon cancer and up to a little over almost 53,000 to pass away from it. 53,000 passed away in 2021.
Okay. All right. But you mentioned that prevention is key to this one.
Absolutely. So the most important highlight is that it doesn't have to be complicated. Your primary care physician, your family doctor, should be the one who can quarterback this for you. So essentially, once you hit the age of 50, possibly as young as 45, your doctor will be asking, has this person been checked?
Mm-hmm. Is the age difference, say, 45, maybe if there's a history of it in the family?
That is actually even younger.
Oh, okay.
So the standard recommendations were 50, but just most recently, there is, as in many things, a guidance group called the United States Preventive Services Task Force. It is a bunch of doctors and scientists who look at everything in medicine and make recommendations about how to mainly screen many kinds of medical conditions, not just cancers.
Okay.
So in their case, they brought the recommendation down to even 45. So what that does is your insurance company has to cover it if somebody thinks there's a reason.
Gotcha.
And this is not that you're having a lot of symptoms or that you have a family history. This is for normal people, normal risk.
Gotcha. Tell us a little bit about the screenings available.
So the easiest one it comes from the doctor's office, where they give you a little cardboard card, just a tiny card, and you just smear a little bit of your stool on there, and they check it for blood.
Okay.
And so you put it on 3 cards, and you take it back to your doctor's office, and they either check it or send it to a lab. There is a fancier one, of which there's more than one type, but Cologuard you hear about actually tests your whole bowel movement, and it looks for the cancerous DNA.
Okay.
So it comes in just a square box with a little bracket that you put on your toilet, and then you also send in a little stool sample, but they look for the DNA, and that test, instead of being once a year for the blood test that I just mentioned, you can do it only every 3 years. The one that everybody's scared of course, is when the doctor looks up you with a camera,
right.
The colonoscopy. And that recommendation is up to every 10 years after you're 50, as long as they don't find something that makes them want to check you more often.
And that's really not that big of a deal, right?
Oh, no.
The procedure itself.
No, not at all. You probably, you're not knocked out a whole lot more than 15 minutes, and then when you wake up, you don't remember anything. Mm-hmm. And so your whole time in the office tends to be not a lot more than a couple hours.
Sure. Well, what are some of the warning signs one might watch for to maybe identify a potential problem?
Absolutely. So the big things, of course, are changes in your bowel movements that you feel like you can't empty, or you have abdominal pain or cramps. Of course, diarrhea or constipation. Or sometimes we say that your stools are getting smaller or thinner. They just don't look normal. Mm-hmm. Or the color is not normal. But from the standpoint of your physician, again, who might check you once in a while, if you're losing weight or you have anemia, you have low red blood count and nobody knows why, that would be a typical time to look for a problem in the colon.
All right. Well, then, what are some treatment plans?
Well, of course, you have to get in with probably with first a gastroenterologist and then possibly a general or a colorectal surgeon who will take the information from looking up there to see maybe where they found it, and they can put either ink marks or clips where they see something, and ultimately, after a CAT scan, the first thing is to figure out whether somebody can take it out. And that usually is a straightforward process. And then the more important thing is the cancer just in one place, or has it spread to any lymph nodes, in which case you might be a candidate for chemotherapy. Very rarely would you get radiation, but chemotherapy is more common.
And that was going to lead me right into my next question. What role does the Radiation Therapy Center play when it involves colorectal cancer?
So unfortunately, we do know that radiation works best if given before surgery for rectal cancers. So you can get anywhere from 1 to 5 weeks of radiation with chemotherapy most commonly, and then somewhere in the range of 3 to 8 weeks later, a surgeon takes it out. So for rectal cancers, which is really the last few inches of your colon, the surgeon can clear the cancer better, and the control rate is much better if you give pre-surgical radiation. So we do that a lot.
Okay. Very good. Morris Hospital is accredited by the Commission on Cancer of the American College of Surgeons as a community cancer program. Dr. Cheng and the staff at the Radiation Therapy Center guide patients through cancer care treatment with warmth and understanding. Morris Hospital ensures access to comprehensive care, state-of-the-art services and equipment, and a multi-specialty team approach. To learn more about the Radiation Therapy Center of Morris Hospital, please call 815-364-8915.